Assalamualaikum and a very good day to everyone that watching today's presentation, especially to our beloved lecturer, which is Madam Harina. So for today's presentation, we'll be presenting about the hip that consists and included in our syllabus at the MRD 446 Applied Anatomy and Radiography. So let's move on to the next slide. So let's continue today's presentation by introduce to you guys who will be our presenter for today's presentation. So the first presenter will be Nur Azmina binti Muhammad Ripin. The next one will be Anis Suraya binti Zainal Azman. The next one will be Farah Nafisa Ayuni binti Muhammad Shahid. And the next presenter will be myself, which is Musfia Arifin binti Mustaza. And the last presenter for today's presentation will be Zul Amirul Fidaus bin Abdul Wahab. It was honored for me to pass the baton to our first presenter, which is Nur Azmina, to continue today's presentation.
The hip consists of two hip bones, one on the left and one on the right side, which are also known as coxal bones or pelvic bones. Each hip bone is located on either side of the pelvis and is connected to the sacrum at the base of the spinal column, forming the sacroiliac joints. So from the anatomy of the hip, we can see the hip bone, the anterior sacroiliac ligament, inguinal ligament, sacrotuberous ligament, sacrospinous ligament, sacrococcygeal ligament, iliolumbar ligament, iliofemoral ligament, pubofemoral ligament, acetabular labrum, articular cartilage, iliac crest, iliac fossa, pubis symphysis, obturator membrane, femur, greater and lesser trochanter of femur, and the lumbar vertebrae. They are connected on both left and right side of the hip bone. The functions of the hip bone, it is as an attachment for the muscles and the ligaments. Next, it forms the pelvis along with the sacrum and the coccyx. Next, it connects the lower limbs with the exoskeleton. Next, it supports the body weight while sitting or moving. It provides stability of the hip while allowing wider range of motion. Last but not least, it acts as shock and impact absorption. The hip bone is made up of three main parts. The first one is ilium, second is ischium, and the third is the pubis. Ilium, it is the widest and the largest part of the hip bone, and it sits superiorly. The body of the ilium, it forms the upper part of the acetabulum, and above the acetabulum, it expands the ilium to form the wing or ala of the ilium, which is broad and flat shaped. And next is ischium. It is found posterior inferiorly. It forms the lower and the back part of the hip bone. It also consists of the body and the inferior and the superior ischiorami. The body part of the ischium is the largest part of the bone that projects upwards to join the ilium and the superior ramus of the pubis. Next is pubis. It is the most anterior part and it lies medially. It consists of the superior and inferior pubic rami, and it connects both left and right sides of the hip bone at the pubis symphysis. Together, these bones contribute to the acetabulum, the socket that forms the hip joint. Moving on with the bones and the joints of the hip, there are three main articulations of the hip bones. First is sacroiliac joint, second is symphysis pubis joint, and the third is the hip joint. Sacroiliac joint, it is a synovial joint where the ilium of the pelvis, it connects with the sacrum of the spine. And next is the symphysis pubis joint. It is a cartilaginous joint that connects both left and right pubic bones. And the third is the hip joint. It is a ball and a socket joint which formed by the femoral head fitting into the acetabulum. And this structure, it provides a wide range of motion, and it is one of the most mobile joints in the body. Breaking down to the compartments of the hip joint, first is the femoral head, which is the rounded end of the femur that fits perfectly into the acetabulum. And next is the acetabulum. It is the socket or a cup-shaped socket on the pelvis. It is deepened by a cartilage rim called the labrum, and this acetabulum will articulate with the femoral head, and it provides stability to the joint.
To begin, we have the intra-articular ligament and four other extra-articular ligaments. The intra-ligament refers to the inside of the joint ligament, which in this case is the ligamentum teres. The ligament of the head of femur, also known as the ligamentum teres, is as labeled in the diagram. Next, we have the extra-articular ligaments, which consist of iliofemoral ligament, ischiofemoral ligament, pubofemoral ligament, and transverse acetabular ligament. The iliofemoral ligament, ilio referring to the ilium and femoral referring to the femur, is also known as the Y ligament of Bigelow and is labeled by the red outline in the diagram. Moving on from that, we have the ischiofemoral ligament. Like before, ischio refers to the ischium and femoral refers to the femur, and is the thinnest ligament in the hip, this time labeled by the color purple in the diagram. Other than that, we have the pubofemoral ligament, pubo referring to the pubic bone, and again femoral referring to the femur. It is also a triangular fan-like ligament and is color-coded by the color blue in the diagram. Lastly, we have the transverse acetabular ligament referring to the flat band-like ligament, which is labeled in the diagram is the color green.
Moving on with the muscles of the hip, the diagram above shows the anterior and the posterior view of the muscles of the hip. So what are the muscles that attach to the hip? For hip flexors, The muscles are iliopsoas muscle, which consists of the physos major and the minor muscles, and iliacus muscle. Next is rectus femoris muscle, sartorius muscle, tensor fasciae latae muscle. Next is hip extensors. The muscles is gluteus maximus muscle, hamstrings, which consists of bicep femoris muscle, semitendinosus muscle, semimembranous muscle. For hip adductors, the muscles are adductus longus muscle, adductor brevis muscle, adductor magnus muscle, gracilis muscle, and pectineus muscle. As for hip abductors, the muscles are gluteus medius muscle and tensor fasciae latae muscle. For hip internal rotators, which is the medial muscle of the hip, it consists of gluteus medius muscle, gluteus minimus muscle, and tensor fasciae latae muscle. Next is hip external rotators, which is the lateral muscle of the hip. It consists of piriformis muscle, obturator internus muscle, obturator externus muscle, superior gemellus muscle, inferior gemellus muscle, quadratus femoris muscle, and gluteus maximus muscle. Based on anatomy of the hip joint is known as ball and socket synovial joint that are formed by the articulations of acetabulum of pelvis and the head of the femur. This joint, it works like ball and socket, which means it can move freely in different directions, either forward and backward, side to side, and it also can twist. So the hip movement is primarily involved with the head of the femur and the acetabulum of the pelvis. So where the head of the femur, it will rotates and glides within the acetabulum. The hip joint allows 3 degrees of freedom of hip. The first one is flexion and extension, which occurs in the sagittal plane. Second is adduction and abduction, which occurs in the coronal plane. And the third is internal and external rotation, which occurs in transverse or horizontal plane and also circumdation. Flexion is the movement that decreases the angle between the tight femur and the pelvis. In simpler terms, it means bringing your thigh forwards and upwards towards your torso. Next is extension. It is the movement that increases the angle between the thigh of the femur and the pelvis. In simpler terms, it means bringing your thigh backward and downward away from your torso. Next is abduction. It is the movement of the thigh that is away from the midline of the body in one plane. And adduction, it is a movement of the thigh towards the midline of the body in one plane. Next is internal rotation. It is a rotational movement of the thigh inwards where the knee or foot turns towards the midline of the body. And next is external rotation. It is a rotational movement of the thigh outwards where the knee or foot turns away from the midline of the body. To differentiate between the pictures shown for the internal and external rotation, we can see the lesser trochanter of the femur. In internal rotation, the lesser trochanter is less prominent because the femur is turning inwards. As for external rotation, the lesser trochanter is more prominent because the femur is turning outwards. And last but not least is circumdation. It is a circular movement that combines flexion, extension, abduction, and adduction. So these are the movements that the hip can do.
Now, let us take a closer look at how the parts of the hip bone are connected. So firstly, we all know that the hip bone is actually made up of 3 different parts, which are the ilium, ischium, and the pubis. When we are kids, these bones are separated and held together by a special type of cartilage called the triradiate cartilage. Now, let us take a closer look at how the parts of the hip bone are connected. As we grow, these 3 bones slowly fuse together at a deep socket called the acetabulum, which is the part of the hip that connects with the femur. This fusion usually finishes sometimes between the ages of 16 and 23. Once it is fully fused, the bones form a single solid structure which is known as the hip bone. As we grow, these 3 bones slowly fuse together at a deep socket called the acetabulum. Now, let us move on to the joints that connect the hip bone. Firstly, we have the pubis symphysis, which is the joint that connects the left and the right pubic bones, and it is located at the anterior part. It is made up of a cartilage with a fibrocartilage disc in between them. It doesn't move much, but that little bit of flexibility helps to absorb shock, and it is especially important during childbirth. Now, let us move on to the joints that connect the hip bone. Firstly, we have the pubis. Now, around the back, which is at the posterior part, there is sacroiliac joint, which is the joint that connects the ilium to the sacrum. This joint is built for strength, where it helps to transfer the weight from our upper body down into our legs. It is a mix of a synovial joint and a fibrous joint, and it is held together by a really strong ligament, and they've got a little space between the bones called a joint cavity, and it is filled with synovial fluid, which acts like a lubricant to keep everything moving smoothly. Now, around the back, which is at the posterior part, there is sacroiliac joint, which is the joint that connects the ilium And finally, there's the hip joint, which is the joint where the acetabulum fits with the head of femur. It is also called the ball and socket joint, which means it can move in a bunch of directions, like bending, straightening, and also rotating your leg. It is also supported by some important ligaments, like the iliofemoral ligament, pubofemoral ligament, and ischiofemoral ligaments, which help to keep it strong and secure. These act like thick straps around the joint, keeping everything tight and preventing too much movement in the wrong direction. And finally, there's the hip joint, which is the joint where the acetabulum fits with the head of femur. Now let us take a closer look at the three main ligaments that helps to support the hip joint, which is the joint where our leg connects to our pelvis. So even though the hip joint can move in many directions, it still needs to be very strong and stable. And now let us jump into the three ligaments that support the hip joint. Now let us take a closer look at the three main ligaments that helps to support the hip joint, which is the first ligament that we have, which is located at the front of our hip, is the iliofemoral ligament, which connects our ilium to the top of the femur. It is actually one of the strongest ligament in the body. Its main function is to stop your hip from bending backward too far, especially when you are standing up straight. It helps to keep our body in a good position without needing our muscles to work too hard. So the first ligament that we have, which is located at the front of our hip, is the next we have the pubofemoral ligament, which is also located at the front, but it is more towards the bottom of the hip joint. And this ligament connects the pubic bone to the top of the femur. This ligament helps to limit how far your leg can move out to the side, or we call it abduction, and how far it can move backward. It protects the joint from stretching too much or going too far in those directions. Next, we have the pubofemoral ligament, which is also located at the front, but it is more towards the bottom. Lastly, we have the ischiofemoral ligament, which is located at the posterior part of the hip joint. It connects the ischium to the back of the femur. Its function is to keep the hip joint stable from behind. It also helps to limit how much your leg can turn inward, or we call it internal rotation, and stops the joint from coming out of place. Lastly, we have the ischiofemoral ligament, which is located at the posterior part. Now, let us focus on the sacroiliac ligaments, which is the ligaments that help to stabilize the sacroiliac joint. And it is a joint that connects the sacrum to the ilium. So even though the sacroiliac ligament, they doesn't move a lot, but it is constantly under pressure because it has to transfer the weight from our upper body to our legs. So let us break down the three main ligaments in the sacroiliac ligament. Now let us focus on the first ligament is the anterior sacroiliac ligament, which is located at the anterior part of the sacroiliac joint. It connects the anterior part of the sacrum to the ilium, and this anterior sacroiliac ligament is not the strongest or the thickest ligament, but it plays a key role in stabilizing the sacroiliac joint during movement. For example, whenever we are twisting, bending, or shifting our weight, this ligament helps to keep the front of our sacroiliac joint from separating or moving too much. So the first ligament is the anterior sacroiliac ligament, which is located at the anterior part of the sacroiliac. Now, moving around to the back of the sacroiliac joint, we have the posterior sacroiliac ligament. Now, this ligament is much more thicker and stronger compared to the anterior sacroiliac ligament, because this ligament stretches from the back of our sacrum to the posterior part of the ilium, which is the posterior superior iliac spine. Now, moving around to the back of the sacroiliac joint, we have the posterior this ligament helps to support the back of the pelvis and plays a big role in preventing the sacrum from shifting backward or rotating too far. It is especially important when we are doing things like lifting, climbing, or landing from a jump. This ligament helps to support the back of the pelvis. Now, the third sacroiliac ligament, which is the strongest and the deepest sacroiliac ligament, which is the interosseous sacroiliac ligament. This ligament lies deep between the sacrum and the ilium, behind the actual joint capsule. So we cannot see this interosseous ligament, but it is hidden. Now, the third sacroiliac ligament, which is the strong. This ligament connects the bony tubercles of the sacrum and the ilium. This ligament is extremely strong, and it acts like the main anchor of the sacroiliac joint. Its function is to hold the bones tightly together and allow for efficient transfer from our upper body to the pelvis and then down into our legs. Without this interosseous ligament, the sacrum could shift or lift under pressure, which could throw off your whole posture and movement. This ligament connects the bony tubercles of the sacrum and the ilium. This ligament is...
Okay, now we will be moving on to how the structure of hip is well suited to their functions. Okay, so the first one that we have is the hip bone. Okay, so the hip bone is a rigid and strong framework. It provides the foundation for stability and weight bearing. Okay, so its durable structure ensures that the body remains upright and balanced, absorbing force effectively during movement, especially during everyday movements such as standing, walking, or running. The hip bone supports efficient motion while minimizing stress on the lower limbs. So, a key features of the hip bone is the perfect fit between the femoral head and acetabulum that form a secure ball and socket joint. Okay, so this deep, well-formed connection enhance the joint stability. So, it also reduce the risk of dislocation while allowing smooth control movements. Okay, so not only that, the hip joint allows multi-directional movement. Okay, making it one of the most versatile joints in the human's body. Okay, so its design, the hip bone design, support flexion, extension, abduction, adduction, and rotation. So this allows effortless transition activities such as walking, bending, and twisting. Okay, so this adaptability ensures the hip remains responsive to various movements while maintaining structural integrity. Okay, so lastly, the hip bone has a wide surface for muscle attachment. So when a lot of muscle attached to the hip bone, it enables a strong muscular support. So the large attachment areas allows muscles to generate force efficiently, assisting in movement and balance. Okay, so this contributes a lot to postural control, ensuring the body remains stable and aligned during activities. The naturally angled inward femur. Okay, that is known as the Q angle, that plays a crucial role in lower limb alignment. Okay, so this inward positioning ensures that the knee and foot align with the body centers of gravity. Okay, so this improves balance and stability. How? By keeping the lower limbs positioned correctly, the body can maintain efficient posture and movement without unnecessary strain. Okay, so the Q angle also optimizes force transmission, which is allowing energy to transfer smoothly through the hip, knee, and foot. Okay, so this ensures that every step and movement is efficient, minimizing energy loss while enhancing propulsion. Okay, so the structure directs forces appropriately, reducing stress on surrounding joints and ensuring controlled movements. Okay, so another key function of the hip structure is its ability to absorb shocks and minimize joint stress. So, by distributing these impact forces, the hip prevents excessive pressure on knees and lower limbs. Okay, so this shocks absorption mechanism is very essential for long-term joint durability, allowing for repetitive movements such as walking and running while maintaining comfort. Okay, so next, the hips enhance weight-bearing capability, which provides stability during standing, walking, and other dynamic activities. Okay, so its structure allows weight to be evenly spread across the lower limbs, reducing localized pressure points. This design ensures long-term support and minimizes wear on surrounding articular cartilage and labrum. So the articular cartilage lining the femoral head and acetabulum plays a crucial role in reducing friction, allowing the bones to glide effortlessly against one another. This smooth surface ensures fluid motion, preventing mechanical wear and tear over time. Additionally, a synovial fluid enhance mobility by maintaining low friction environment, ensuring seamless articulation and preventing excessive rubbing between joint surfaces. So beyond reducing friction, the hip joint distributes mechanical stress evenly across its surface. This efficient load distribution prevents localized pressure points, ensuring balanced force transmission. So, how? By spreading the force generated during movement, the hip protects surrounding bones and tissue from excessive strain. Additionally, the presence of cartilage cushioning enhances shock absorption, minimizing the impact forces experienced during activities such as walking, running, and jumping. This protective mechanism is significantly reduce stress on the joint, safeguarding it from the long-term damage. Okay, so the acetabulum's depth that plays a very vital role in joint security, which form a stable socket and joint that holds the femoral head firmly in its place. So this deepening effect, further reinforced by the acetabular labrum, enhance joint stability, preventing excessive motion while maintaining smooth mobility. Okay, so the labrum also helps in maintain joint pressure, which is by creating a suction effect that ensures a secure fit between joint surfaces. So this stability reduces the
likelihood of dislocation, so that allowing control and precise movement without compromising the security. So, furthermore, the hip joint prevents inflammation and injury to surrounding tissues through its natural lubrication and shock absorption capabilities. So, the presence of synovial fluid prevents excessive friction, reducing irritation and inflammation within the joint. So additionally, proper stress distribution minimize mechanical strain on the hip, preserving the integrity of soft tissues and protecting them from degeneration or damage. Okay.
First, the ligament of the head of femur, also known as the ligamentum teres. It is a thin and slack ligament in adults that are prone to tearing in hip dislocation due to its weak structure. It is unique due to its function of supplying the femoral head with blood during childhood. It also has a mechanoreceptor function for awareness of the joint, but it is rather redundant for adults with only contributing a small amount of stability during certain positions. Next, the transverse acetabular ligament, a flat band-like ligament made of dense fibrous tissue. It is important in maintaining the femoral head in acetabulum during growth. It is also rarely injured alone, but may be involved in acetabular fractures. In terms of stability, it stabilizes the femoral head by reinforcing the acetabulum's rim, thus preventing inferior displacement of the femur. It is also a conduit for neurovascular structures, which means that the artery and nerve pass beneath it to enter the hip joint. Lastly, it contributes greatly in terms of load distribution by transmitting the forces evenly across the acetabulum during weight-bearing position like standing. Thirdly, we have the iliofemoral ligament, which is also known as the Y ligament of Bigelow. It is inserted through the intertrochanteric line of the femur, forming superior and inferior bands, and rarely gets torn due to its tensile strength. As mentioned before, it can withstand a force up to 350 kilograms, making it easily the strongest ligament in the body. The iliofemoral ligament also assists greatly in resisting hip hyperextension and limiting the external rotation of the femur. It's also noted that during hip flexion, its flexion allows for movement without resistance. Moving on from that, we go into the pubofemoral ligament. It is a triangular, fan-like ligament that can indicate severe damage if torn due to how rare for it to be torn alone. It blends with the inferior iliofemoral ligament and lesser trochanter. Its functions are as follows: resisting excessive abduction and extension from split-like movement by tightening itself. It limits external rotation, and it also provides a hammock-like support to the femoral head. And last but not least, we have the ischiofemoral ligament, the thinnest hip ligament located posteriorly to the hip. It will tighten during hip extension with its spiral orientation, and also spiral upward to attach to the medial surface of the greater trochanter. It will be torn apart during posterior hip dislocation. Its function is to limit internal rotation by becoming taut and can also restrain hyperextension. It can function in tandem with iliofemoral and pubofemoral ligaments to control the hip motion effectively.
Assalamualaikum and have a good day to everyone that watching today's presentation. Before I start, let me introduce myself. My name is Musfira Arifin, and today I will be presenting about the physiology of muscle in the hip and how they contribute to different movements like flexion, extension, abduction, adduction, internal and also external rotation. Let's begin with our presentation today, which is the first one is movement of hip flexion. So you may wonder how it happened. So it happened when the process began when the brain sent a motor signal through a spinal cord and peripheral nerve. So this signal will reaches our primary muscle that called as iliopsoas muscle, which is made up by psoas major and iliacs. This muscle will insert into the last trochanter of our femur. When they contract, they will pull the femur upward and producing the hip flexion. During this movement, muscle like gluteus maximus and hamstring muscle will be relaxed, and other muscles that involved in this movement will also known as rectus femoris that help in extending the knee, and also other muscle like sartorius, which is a very long and thin muscle that help in assist in hip flexion also. But other than that, is like movement in abduction and lateral rotation. And other muscle is like tensor fasciae latae, or known as TFL, and pectineus muscle, also one of the muscle that contribute to hip flexion, especially during walking or lifting the leg. Next, let's moving on with our next movement, which is extension of the hip. So the hip extension also begin with the brain send a signal to the motor to activate the muscle known as gluteus muscles. So this gluteus muscle is consists of gluteus maximus, and this gluteus maximus will be contract and pull the femur backward. So it will increase the angle of the hip. At this time, the ipsoas muscle, rectus femoris, sartorius, and TFL muscle will be relaxed. To be included, there are hamstring muscle that consists of bicep femoris, semitendinous, and semimembranous muscle will also involve in this movement. How they work is when they contract, they will pull the femur from behind, and it allows us to stand from the seated position, walk, run, and climb a stair. So let's continue to the next movement of the hip, which is also known as abduction. So abduction also begins when the brain sends a motor signal through the spinal cord and peripheral nerve. So this motor signal will activate muscle known as gluteus medius and gluteus minimus muscle. So when these two muscles started to activate, they will started to contract and pull the femur laterally and moving the leg outward or away from our body. So when these muscles started to contract, the other muscle like adductor group, gracilis, and patelis muscle will be relaxed during this time. Other muscle like tensor fasciae lati, or known as TFL muscle, will also help in assist in this movement. Like how they will stabilize our hip and exerting the lateral force on the femur. In addition, the other muscle like the upper fiber of gluteus maximus also very helpful. Like they will help in support the abduction movement during very forceful movement. So like how this muscle is actually generate when the movement generate when by shortening and pulling on their insertion, which is the point on the femur, by allowing our leg to move sideways. And this movement is very important to us because when we wanted to do activity such as stepping to the side, balancing on one leg, and it help also stabilize our pelvis during working or even running. So moving on to the next movement, which is adduction. Adduction also begin like brain send motor signal through spinal cord and peripheral nerve. So this signal will reaches to adductor group and started to contract. So adductor group consists of adductor longus, adductor brevis, adductor magnus, gracilis, and patelis muscle. And all of these muscle will be contract and pull the femur medially. Is opposite from the adduction. Uh, it will bring and drawing the leg inward and towards our body. So, however, gluteus medius, gluteus minimus, and TFL muscle will be relaxed during this time. Other than that, the gracilis muscle, a very long and thin muscle, also help in crosses both of our hip and knee joint. So it contributes to this action by shortening during contraction and pulling on the femur on the medial side. This muscle is actually will reduce the angle between the hip and maintain balance during activities such as walking, standing on one foot, or even like crossing our. So let's continue to our last slide for today's presentation that consists of internal and external rotation. So let's begin with the first one, which is internal rotation. So internal rotation also begin when the brain started to activate the muscles gluteus medius, gluteus minimus, and TFL muscle. So when all the muscles started to contract, they will apply a twisting force on the femur, and it happened to rotate it inward. So other muscle like piriformis, obturator intern, obturator extern, gemellus, quadratus femoris, and gluteus maximus will be relaxed during this time. Other muscle like adductor longus, adductor brevis, and pectinis will assist in internal rotation when the hip is flexed. So these muscles work together by shortening during contraction and pulling on their insertion point in a way that it turns the femur medially. So internal rotation is very, very important because when we wanted to do action like walking, pivoting, or stabilize, it also helps in stabilize our pelvis during a single leg stance. Other than that is our last one, which is external rotation. It also seem like internal rotation, it begin when a brain started to send a signal to the muscle to activate, which is gluteus maximus and lateral rotator group. So lateral rotator group is a small of muscle group that is very deep and collectively, and is consists of piriformis, orbital internus, orbital externus, gemellus superior, gemellus inferior, and quadratus femoris. When all of these muscles started to be contract, they will pull on the femur in such a way that it rotate laterally. So other muscle like gluteus medius, gluteus minimus, TFL, and adductor group will be relaxed during this time. So other muscle like sartorius muscle, it also help in this action, especially when combined with the hip flexion and abduction. Like how? Through their coordinate contraction, this muscle will rotate the femur outward. So when it rotates the femur outward, it enables the movement such as turning the leg outward also. So it's changing the direction while we walking, or even when we stabilize, and even it stabilize the hip during activity like involving twisting or even pivoting. So in conclusion, of a hip movement, whether it's flexion, extension, adduction, internal or even external rotation, is a result of a coordinated process. So this brain will send a signal to the muscle, and muscle will be contract, and other muscle or the opposite muscle will be relaxed. All of this teamwork of the muscle group is enable us to move efficiently and stay balanced during our activity. So that's all from me. Thank you
The
for
male
watching.
and female pelvises mostly bear resemblance, but there are many major differences between them. Firstly, the male pelvis is narrower and deeper with a smaller inlet compared to a female pelvis. The female pelvis also has a further apart ischium compared to the male pelvis that has a closer ischium. The female pelvis also has a wider pubic arch and shorter and wider sacrum compared to the males. The male pelvis does not have a movable coccyx, while the female pelvis does. Lastly, the male pelvis has two closer and angled outward acetabula compared to the female. A drawing of the male pelvis compared to a radiograph of the male pelvis. These are the labeling of the important anatomical structure of the male. This is the female pelvis's drawing compared to the radiograph of the female pelvis. Again, these are the important anatomical structures of the female pelvis. These are some extra drawings made of the pelvis in lateral view and also the femur from the posterior view.